Diabetes is a serious chronic condition that requires patients to be aware of its consequences and to be taking care of themselves to be able to live with diabetes. A diabetic patient needs to do three things: take the medicine correctly, measure the blood sugar, and take certain medications that are not for diabetes but are very related. So basically we are talking about adherence. Adherence to diabetic medications. If you see a profile of a patient that's taking Januvia, metformin, insulin, patient taking glyburide, Victoza, all of those are diabetes medications that patients need to be taking. But also a diabetic patient, most of them need to be taking a medication called an ACE or an ARB, a lisinopril, a losartan, a valsartan. This is an ACE or an ARB, which protects the patient's kidneys from the long-term effects of diabetes. This is a medication a diabetic patient needs to be taking, and also a diabetic patient needs to be taking simvastatin, atorvastatin, Crestor. These are. This is a flowchart that Demi and Shama designed. This flowchart will take us through a journey of adherence with patients who call us at Hayat. A patient calls you, you answer the phone call. Then you realize that the patient is taking one of those classes of diabetes medication, an insulin, metformin, glipizide, an Actus, Janomet, Gentadueto. These are the most of the diabetes medications that patients are going to be asking you for, or you're going to recognize in the profile of the patient. What do you do then? What you do is that there is a jingle bell that jingles in your mind, and you bring this chart, this flow chart, and you start utilizing it. What do you check for? You check for the last fills of those medications. ACE or an ARB, a lisinopril, an enalapril, a valsartan, a losartan. Check for the last refill of those medication in the TX profile. See if the patient is up to date with those fills or not. If patient is not up to date, you fill the ACE or an ARB. Third step is to check for the statin. Is the patient taking the atorvastatin, the simvastatin, the Crestor, the luvastatin? Any statin patient is taking, is the patient up to date or not? Or you find out that the patient is not taking a statin, not taking an ACE or an ARB. What do you do then? You talk to me. You talk to Demi. You talk to the pharmacist. You talk to the intern. Tell them, I found a patient who's not up to date with taking the ACE or an ARB or a statin. We will take care of it. We'll fax the doctor asking if the patient doesn't have a contraindication to taking those key medications, the patient needs to take them. We try to improve the health condition of our patients. After that, after you finish this step, here comes the red spark. Is the patient on SMM program or not? Check the address of the patient. Is there SMM or not? If no SMM word before the address, this is an opportunity to make sure that this patient is taken care of. You ask the patient, how about we make sure that you are taken care of? We have a program, a beautiful program, in which a technician is gonna make sure that you get your key medications every month, refill them, give you a call, and tell you you are receiving 1, 2, 3, 4 medications. The co-payment is X amount of dollars, and we can send it to you at specific time that's suitable for you, or you can pick it up. We will make sure that you are never out of your medications again. Or if you're no refills, we're gonna fax the doctor right away. And if the doctor doesn't want to write a refill and he wants to see you, you have a full month to see the doctor before you run out of your medications. This is not a normal phone call. This is not customer service. This is an adherence call. We want to utilize this. This is a purple star. It's the same color as a Simplify My Meds purple enrollment form present at every pharmacy. This purple enrollment form in the SMM program you're going to utilize to sign up patients for the SMM program. You're going to write the name of the patient, the date of birth, and the date of enrollment or date of signing up the patient, and give this form to the SMM specialist at your pharmacy or at the satellite pharmacy, utilizing the flow chart with the diabetic patients, enrolling patients in the SMM program. Mission accomplished. Lastly, I would like to thank Demi and Shama for designing this, and I would like to thank you all for being the best part of Hayat.